Bom dia a todos e a todas. Prazer imenso de estar aqui nesse momento, uma importante palestra do Dr. Eduardo. Iremos aprender um pouco sobre o que podemos fazer no futuro para termos um serviço de saúde, profissionais, pessoas com estilo de vida diferenciado, para que a gente possa, de fato, produzir mais saúde, mesmo num espaço de atendimento de doenças. Não vou me alongar, é um prazer estar aqui, agradeço à Unidas pelo convite de estar coordenando essa mesa, e vamos ouvir o professor Eduardo com o que ele tem para nos ensinar.
I'd like to share with you, as I'm learning a lot about Brazil, what we're doing both in the United States and then actually starting with some colleagues here in Brazil to introduce lifestyle medicine to basically to the world, and I'll explain what that means. And one of the messages that I have for you right away is that we're not just talking about the patients, we're talking about you as individuals. So I'll try to include you in my talk as we talk about the healthy behaviors that we all need. I'll start off with the idea that we know right now why, as I look out at people who I'm just meeting now, why most of you will actually die earlier than you need to. Why people in your family, your loved ones, the people that you work with are going to die prematurely, and it's because of our behaviors. We also know the root cause, the behaviors that cause 2/3 of all disease. And this is not just the United States, this is not just Brazil, this is across the world. And then pertinent to this audience, and increasingly in the United States, we're worried about the money that's being spent to take care of things that are preventable. So if we know why we're going to die early, and we know what the cause of disease and where the money is being wasted, shouldn't we be teaching this to doctors and to nurses? And yet we're not. And shouldn't we have a healthcare system that actually focuses on that? Because taking care of sickness and just trying to cure it is no longer affordable sort of across the world. So I'll give you some details about this. The combined impact of all of these different behaviors, and these include physical inactivity. How active are you in your daily life? Obesity, which is not a behavior, it's an outcome, but the how much weight you're carrying that we don't need to for our health. Poor diet, cigarette smoking, excess alcohol beyond a drink a day are responsible for more than half of all deaths across the world, and that's all-cause mortality. Just about half of cancer mortality, and heart disease, about 3/4 is the result of behaviors. If you look at it from a disease perspective, 70% of cardiovascular disease, heart disease, could be delayed or prevented with lifestyle modifications. And one of the distinctions between lifestyle medicine and prevention is that you can use lifestyle as a treatment. In other words, someone comes into my office, they already have heart disease, we talk about what they can do in order to reduce the treatments that they need, or to increase their life and improve their health by changing their diet, their exercise, beginning to meditate and all. World Health Organization says that by 2020, which is happening very soon, 2/3 of disease worldwide is the result of our behaviors. So we'd like to say in the United States that we know how to do these behaviors. We know how to smoke, we know how to be stressed, we know how to overeat, and how to not get enough activity. This is now a worldwide phenomena. So I'd actually like to include all of you in this process, and I invite everyone to stand up together. First off, it's healthier than sitting. I'm going to have you all stand up, please. And we're going to do a little poll, okay? Once you're all standing. So what I'd like to do is we're going to understand the behaviors of the people in the audience, because the first thing I'll ask you to do, there's only 5 behaviors we'll talk about. If you smoke or use tobacco products, I'd like you to sit down. Not too many smokers in here. If your BMI, your body mass index, is over 25, If you don't know what your BMI is, if you can grab onto your belly more than maybe 3 centimeters, we're going to figure out that you're a little bit too heavy. So your BMI of more than 25 is actually going to be an indicator of poor health. So if do people know their BMIs? There should be some more people sitting than there are. Okay. If you're not eating 5 fruits and vegetables per day, we need for you to sit down. This is every day. The crowd is becoming thinner. If you're drinking more than 1 alcoholic drink on average per day, you need to sit down. There was very good wine and alcohol last night. I'm talking on an average basis. And lastly, if you're not getting 150 minutes, 2.5 hours a week of physical activity, I need for you to sit down. Okay, the people that are still standing are our teachers, okay? Because we need to understand the behaviors and how some people can do these behaviors. You're welcome to keep on standing, it's healthier, but if you'd like to sit, that's fine also. Worldwide, it's only usually about 3% of the population that actually does all of these behaviors. And those people have a much better chance of not getting cognitive diseases like dementia, of not having heart disease, of not having strokes, of not having diabetes. Upwards of 70% improvement if you were still standing at the end compared to someone who does none of these behaviors, the people who had to sit down in the beginning. So this applies to you. What you do will affect your families, what you do in your work site, and working with health plans and hospitals and doctors groups has a ripple effect throughout. Healthcare costs in the United States are now approaching $3 trillion, 9 trillion rea, and most of it is being spent on healthcare expenditures for chronic disease, which is very close to lifestyle disease. So what we're talking about here is a model to evolve, or maybe perhaps not more than just an evolution, a revolution in healthcare, simply because we can't afford what we're doing right now. It's bankrupting the United States, it's bankrupting countries around the world, and what I've learned about Brazil, this country is suffering from the same burden of preventable illness. So lifestyle medicine is a chance to train the clinicians so they can do this. So you can change the health plans, but if the doctor and the nurse don't know how to talk to their patients about their health, we're not going to get the message across. And we also need to make sure that the doctors and the nurses and the clinicians are appropriately paid to do this. If you look at the money that will be spent in the United States by 2019, we're talking about $4.5 trillion a year. This is a lot of money. About 2/3 is being spent on our preventable disease. So that's $3 trillion a year that will be wasted in the United States in just a few years from now. So what I'll propose to you is that we can't change everything, but what we're going to ask you to think about personally, and then also for your work and for what needs to happen in the world, that we make a 2% change. Think about something that you can do that'll make a 2% change. You walk a little bit more, you drink a little bit less. So just a 2% change is what we're looking for. That would save over $60 billion a year in the United States. And the numbers are probably, we could figure them out for Brazil. So that's what's called a wellness dividend. The next thing is always follow the money to figure out how you can change behaviors. What's interesting is if you start to follow the money, when I speak to the health plans in the United States, they actually say, we're not that interested because the people change the health plans too frequently. This is actually the time of the year in the United States when people sign up for new health plans and they'll switch from one to the other. But the employers are very interested. The self-insured employers. Why? Because people don't like to switch their jobs. They have no alliance with a health plan, but they have a great alliance with their employer. especially if it's a good employer or if the benefits are good. So we like to now, we're going to focus on the self-insured employers. So far as we go through this talk, we understand that death, disease, and healthcare costs are the result primarily of our behaviors. We're going to define lifestyle medicine now as an answer to this and invite you to join this movement. We'll focus on 4 cases of self-insured employers that I'm familiar with or have worked with in some way that are leading the charge and making some very interesting changes. And then I'll tell you about my personal passion, which is actually educating doctors and nurses worldwide so that we can be part of this. Back in 2009, if you're going to start a revolution in medicine, you need to publish. So back in 2009, I joined a group that met, and we put together an article that was published in the Journal of the American Medical Association about establishing what is lifestyle medicine, and we defined it as an evidence-based practice. The evidence is there. We know that smoking is bad. We know that physical activity is good. We have to translate this for ourselves and our patients. So it's an evidence-based field of assisting individuals and their families to adopt and sustain behaviors that can improve health and the quality of life. The word I'm just going to focus on for a second is actually sustaining behaviors is actually kind of tough. It's relatively easy to lose weight. It's much harder to keep it off. It's almost New Year's here, everywhere. Many people will go to the gym, and they'll be very excited for a week or 2, maybe a month. We call them tourists at the health club. And then by February, they're back to their old ways. We need to sustain the changes. And this is a definition that we published for lifestyle medicine. So we understand the causes. I'll also tell you that there is a wonderful potency, a strength to doctors talking to their patients about lifestyle. And yet, we don't do it enough. Partly is that we're not educated in how to do this. The doctors' behaviors need to improve as well. And we're not trained, so we need to train the doctors again. What's interesting is that they've done studies in the United States from consulting firms, and they realized for the $3 trillion that are being spent, the doctor's pen, okay, or I should show you, or maybe their keyboard now with an electronic record, we are in control of 80% of the expenditures. So there's only so many doctors. We're controlling trillions of dollars of expenditures. So that's why we're working through the doctors, because if we can get doctors to say, oh, maybe you could take this pill for your blood pressure because your blood pressure is high, but take it with a 3-kilometer walk. This is a healthier way of taking it. Take this pill for your diabetes, but make sure that you don't take it with a piece of chocolate cake. Okay, this may be a way to integrate lifestyle in there and actually save money from just going for another test or another surgery. Another group recently, this is just last month, this is now an international group, including doctors from Australia, from Europe. We'd love to have some South American doctors join us, put together an article just last month in which we defined lifestyle as a branch, again, of evidence-based medicine in which comprehensive lifestyle changes. So it's nutrition and physical activity and stress, but we've also now included social support and changing the environment. The environment could be where you work, and the conditions under which you work are used to prevent, to treat, and to reverse the progression of chronic diseases by addressing the underlying causes. So we're now focusing. It's expanded to include the social support. The family is important. I could talk to Martha over here, and if she does the shopping at home, changing what you cook is going to change what your family eats. If you pack your children a lunch, that may be healthier than what they might buy on their own. Same thing for husbands. And also, we're talking now about actual treatment with lifestyle. Another way of looking at this is that there is, in the midst of this sort of a sick care industry of $2.9 or $3 trillion in the United States, and wrapped around it is a wellness industry. Almost $500 billion of wellness industry, and yet there's a wall between the two of them. So as a physician, I'm warned against, oh, this person is running a health club. They want to make money. That's okay. My patients need exercise. The health club may be the best place for them. So we're trying to sort of break down the walls between sick care and wellness care. So it's just another way of looking at lifestyle, so that you understand that it's not just me saying, oh, this is a great idea. We actually have lifestyle medicine now includes a journal that's been out since 2007. So this is a well-established American Journal of Lifestyle Medicine. There's an encyclopedia that just came out last year by the same publisher and by Dr. Jim Rippey, who's probably the grandfather of the whole field. There's an American College of Lifestyle Medicine. You don't have to be a physician to join this. Doctors and nurses and clinicians from around the world can join the American College of Lifestyle Medicine. The meetings that we hold are booming. We went from a few years ago, we had 40 people, everyone was sitting around a table. The next year there were 80 when we made our own conference. The next year there were 160, and then 250. And a few weeks ago in San Diego, we had over 500 people. So year on year, the American College of Lifestyle Medicine meeting is booming because the time is now for this. We're meeting again in Nashville, Tennessee. If you like country music, even if you don't like country music, you can come to the meeting early November next year. There's now a European Society of Lifestyle Medicine that's just being launched this past year. There's a conference, if you don't want to go to Nashville, maybe join us in Paris in March of 2015. It's a small workshop and then a bigger meeting in the fall. And we're also working on launching a second journal, which will now be an international journal of lifestyle medicine. So my colleagues in Europe, when they say Europe, they think of anything other than the United States. So anyone can join either or both organizations. So as we talk about the causes, we talk about defining lifestyle medicine as an answer, which we can all be part of. Now let me spend a few minutes looking at some self-insured employers and how they've taken this on and the changes that they've made. So I'll take you through where I work in Boston at Massachusetts General Hospital. The U.S. Department of Defense, if you look at them as a self-insured employer. Cummins, which makes diesel engines and actually has interests in Brazil, and then a healthcare system in South Carolina. So I'll tell you the quick story about Massachusetts General Hospital. It's an enormous enterprise. I think we have maybe over 15,000 employees. We have a budget of several $1 billion a year, major research, people fly in from around the world, and we also take care of people in Boston. And yet, the money is made from the sick care industry because people will come in, and if you have a heart attack, that's how you get paid. And if I do an injection, that's how I get paid. So I went to the president of the hospital, and I said, when will we evolve to become a healthcare institution? When will we start to actually promote health? And he looked at me and wished that I would disappear. So I didn't disappear, so he just turned his back. So I followed him onto the elevator. So in the elevator, there were just two of us. So I said to him again, Dr. Slavin, tell me, what will it take for Massachusetts General Hospital to become a healthcare entity and not just take care of people when they're broken? And though the money is still in the sick care, finally he looked at me and he said, if you talk to me as an employer, I'm interested. So I said, as an employer, sir, with 15,000 employees plus dependents, when will we become a healthcare institution? And he said, now I'm interested. You should talk, we're setting up an ambulatory practice of the future. In the United States, part of our Obamacare is to set up what are called patient-centered medical homes. Before, I guess they were doctor-centered, or some people said money-centered. Now they're patient-centered. So I went to consult with this group, And part of what happened, so that they set up this center, and then they next realized that, oh, we should admit patients to, this is for outpatient care, that are employees of the hospital. Why? Because Dr. Slavin is paying for their care, and he wants to save the money. So there's a long-term experiment going on now called the Patient-Centered Medical Home, the Ambulatory Practice of the Future. And what they did as part of it, which was interesting when we spoke to them, is that they took nurses, they took exercise physiologists and trained them as health coaches within the practice. So when you come in there, they're interested in maintaining your health. They're interested in actually having an exercise physiologist teach you how to do exercise before you leave the office. If you need to learn how to cook, they'll find you someone to do that. So this is sort of a health care company, a large hospital, now just looking at themselves as a self-insured employer. Cummins is very interesting. They make diesel engines. It's one of the biggest companies in the world. They have over 100,000 insureds, and their new global wellness director, Dexter Sherney, took over about 2 years ago, and he said, well, if I have 100,000 people I'm responsible for, I'm spending hundreds of millions of dollars a year on their health care. And I know, because I'm a preventive medicine doc and I understand lifestyle medicine, that most of that money could be saved. Then he went to look at the doctors who work in his clinics. There are on-site occupational medicine clinics, and he said, you don't know about lifestyle medicine. They go, no, what's that? He said, well, I want you to be certified in lifestyle medicine. I want you to train so you know how to talk to people, how to counsel them about diet and exercise. I want you to be healthier yourself. And they said, well, we'll do the training if you require it of us. Where's the training? And there was no training to be done. Our group, the Institute of Lifestyle Medicine, does training, but it's not formalized enough, and it wasn't available on the web. So he came up with money to create a certificate of completion in lifestyle medicine. It's just being released probably January or February of this year, the next couple of months, through the American College of Preventive Medicine. So it'll be a 30-hour curriculum. It's in English. Doctors, nurses, anyone in the world can take it. And at the end of it, you'll get a certificate of completion. So it's just a start. Down the line, we'll hopefully have a board of lifestyle medicine, but this is a beginning. Dexter Sherney came to speak at our Institute of Lifestyle Medicine conference last June. He announced this requirement, and I looked at him and I said, Cummins is a huge company, $20 billion or so per year. If you're doing this, what about Microsoft? What about Google? What about IBM? What about the other major companies? Why wouldn't they follow to require their doctors? He said, they're already talking. This is the next thing. We can ask these doctors to become certified in this. And if you don't work for him directly, but you want to see his patients, he can also ask maybe instead of 30 hours, 5 or 6 hours, just to begin the process of entering lifestyle medicine. And we're holding the doctors accountable because they want to get paid and they want to see these patients. So this is a major thing going on. The next group I'll tell you about, in Washington, there's a group called the Bipartisan Policy Center. They study all of the problems of the United States, whether it's the environment or whether it's education. They finally got to healthcare. And they looked at healthcare, and they came up with 26 different recommendations about how to save healthcare and save the health of the American public. There are two of them, and I'll tell you first off, the name of the report is really interesting. It is Lots to Lose: How America's Health and Obesity Crisis Threatens Our Economic Future. This is not about people shouldn't be sick. This is about money. And in it, they had two recommendations that I'll highlight. One of them is that doctors need to learn about nutrition and physical activity. The second issue that I'll highlight is they looked at the Department of Defense in the United States. So the Department of Defense, this is everything from the Army and the Navy and the Air Force and the Marines, has almost 1.5 million active duty people and another million in reserve. There's a huge pool of patients. Think of this as a large, perhaps one of the largest self-insured groups on the planet.
okay, over 2.5 million lives. They're spending $50 billion per year on on the health care of the employees, which are the soldiers and the Air Force and the Navy folks and all of the support services. And they said, my gosh, this is 10% of our budget. This is a lot of money. And not only that, but they're cutting back the money that we're getting. Perhaps we can save some money by having people be healthier when they're in the Army. So with the recommendations that are put out there, they're changing what a soldier eats. So they call it soldier fueling. People don't like to hear about diet, so they're talking about the fueling. And it's like, what will you eat on the base? They're talking about the built environment. Is it going to make it easier to walk around rather than always get into a Jeep to get from one place to place when you're on a base? For the women in the armed services, they want to make sure there's a place for them to breastfeed their babies. They're concerned about the child health because the Army bases have children living there, and they're responsible for the health of the children. Preventive care, dental care is a big issue. There are many people that want to be in the military, their teeth aren't good enough. And it actually costs us money to try to say, oh, sorry, go fix your teeth if you want to be on a Navy ship. So this is the Department of Defense making major changes. And this is a meeting where we discussed the other part of it, which was the education. Greenville Health System is the last one that I'll put out here, is the 13th largest healthcare system in the United States. What's interesting is they're transforming. This is a city in South Carolina. They went and they actually took their electronic record. They started to put in a physical activity vital sign. We sort of did one a few minutes ago. A bunch of people sat down when I did that one, said, are you getting your 150 minutes per week of moderate intensity physical activity? They put that into their record. Then they started saying, oh, if you're not getting enough physical activity, we need to get someone to help you. So this is all in their electronic record. And they wanted to say, oh, it's one thing if you're not being active, it's another thing if you already have diabetes, we need a special person to help you become more active because you have to watch out for your blood sugars as you start to lift weights and get more active. Then they said, well, who can we refer them to? Because the doctors and the nurses don't know enough. So then they trained 25 folks through a program called Exercises Medicine, which is a now international effort, which I'm involved with through the American College of Sports Medicine, and we need to get it into Brazil. So they credentialed 25 folks that would be able to accept patients to get them more active. And what's interesting here, as a self-insured employer, they have a whole city with 1 million plus people living in the area, and they said, you know what? Let's start with our employees. We know them, and we're financially responsible for them. So GHS is the Greenville Health System. They looked at their at-risk employees, and then they looked at their at-risk patients because they are financially responsible for them. So again, this is a healthcare system which is thinking ahead and saying that we need to change the environment, we need to make it available for people to get more active. They actually have intervention advisors. So lifestyle medicine is not just about doctors. We like to use the word medicine because if the doctors don't hear that, they're not interested. But this is a kind of medicine that we need nurses to do. We need healthcare educators. We need diabetic specialists, dietitians, psychologists. We need the whole system. We need the whole system here. So we have these credentialed professionals that are taking on patients, and they're going into programs that are willing to accept patients into them. The average health club, and there's some beautiful health clubs here in Brazil, are used to the healthy, fit people that are coming to work out with them. It's the same people. They switch from one health club to another, maybe 20% of the population. It's the other 60 or 80% that have never been to a health club that need it. And we need for the health clubs to absorb them, and that's what they're doing there through a program. And they start off with a physical activity intervention, changing sedentary lifestyles. You're sedentary if you're sitting too much, and then going through the overweight all the way down through the whole healthcare system. And at the end, they're looking to get to increasing physical activity, decreasing healthcare costs. This is the bottom line. And this program is focused on physical activity. You could do the same with stress. You could do the same with sleep. You can do the same thing with diet. If you're going to make a change in the medical world, you need to publish. This is an article that I published in the British Journal of Sports Medicine with my colleague in South Carolina about the efforts to get exercise as medicine in there, to start with the employees and the patients at Greenville Health System. I'm going to start wrapping up here, and we'll take some questions and figure out how to improve the world, starting with the folks that you touch every day, to understand that for this all to happen, we need to change the educational system. There's a huge effort to educate patients out there. It's here in Brazil, it's certainly in the United States, but people don't listen, or they don't think it's about them until the doctor or nurse says, "Did you see that advertisement?" I've got patients that come in, it's very funny, they say, "My knee hurts." And I go, "And how can I help you?" That's the kind of medicine I do, musculoskeletal. And I go, they said, "I read the internet." And they read for hours and hours. And I go, "So why are you here? You're an expert now." And then they go, "Well, I need to know what's important for me. Which part should I pay attention to?" If they hear that they're supposed to be active, they hear that they should be eating less, they hear that they should sleep more, they hear they shouldn't be smoking, it's the doctor who needs to personalize this for patients. So we have in Boston the Institute of Lifestyle Medicine, which we founded back in 2007. It's now at Joslin Diabetes Center. Our goal is not to work directly with patients because there's plenty of material out there for them, but to go after a group that was otherwise forgotten, and that's the clinicians. And we're trying to change the way that clinicians, all healthcare providers, are speaking to their patients, what they're saying, and we're trying to transform the practice of medicine. Another piece of this is that the average primary care doctor in the United States, as per a recent survey, would quit practicing medicine because it's too stressful. One of the reasons many of them don't quit is because they can't do anything else. It was so hard to get through medical school and maintain their practice. They can't do it. They've never been trained to do anything else, so they keep on practicing. Some of them stop practicing, very sadly, because they commit suicide. And the suicide rate actually amongst doctors in the United States is twice that of the population. This is a sad commentary. It's even higher in female physicians. This is a terrible thing because the stress of practicing medicine is so great. Lifestyle medicine is actually a much gentler way of practicing. There's a wonderful expression that a colleague of mine has, which is that when you're doing coaching or sort of lifestyle medicine with a patient, rather than wrestling with them, where you can get hurt, it's more like dancing with them. It's much harder to get hurt dancing. Although when I tried to samba the other night with my wife,